Today I'll be talking about the pharmacological management of hypertension. So in our previous talk, we talked about the lifestyle management of hypertension, and in the lifestyle class, which is the first line management, we looked at diet, and we also looked at exercises. So today we are going to look at the drugs used for the treatment of hypertension. So among the drugs that have been used for the management of hypertension, there are four main classes which are the starting drugs in the management of hypertension. The first drug is what we call the thiazide diuretic or the thiazide-like diuretics. So these are drugs that help remove the excess fluids from the body by working on the kidneys, and by the reduction in volume, then that helps to lower the blood pressure. The main disadvantage with this drug is that they can cause loss of potassium, that causing potassium depletion in the body. If used in higher doses, drugs like hydrochlorothiazide, they can cause an increase in uric acid in the body, and they have mild effect on the elevation of the blood sugar. So we tend to use lower doses so that we avoid these side effects. The other class of drugs used in treatment of hypertension is what we call the angiotensin converting enzyme inhibitors. These are drugs, the names end with RIL, R-I-L, and they also work in the kidney system, and they help in vasodilation, so that through the dilating the vessels, then you have a decrease in blood pressure, and they can also help in potassium retention, which potassium is also necessary in the treatment in the lowering of blood pressure. The main challenge with these drugs, or the main side effect, is they can cause a cough that comes from the throat. Is usually irritating, and they can also have what we call a generotic edema, which is kind of an allergic reaction where you have a generalized body swelling. Some people can also get swelling of the eyes or swelling of the lips. So when you notice some of these side effects, the treatment for it is just to stop the drugs. Then the next group of drugs is what we call the calcium channel blockers. These are drugs that act to also help in dilating the blood vessels, usually the venous system, and so they are very effective in lowering the blood pressure. The main side effects of these drugs, because of the action in dilating the blood vessels, then they can cause dizziness, they can cause throbbing headache, and they can also cause a leg swelling. Then the other group is what we call the angiotensin receptor blockers. The angiotensin receptor blockers, they also work in the kidneys, and they are also potassium sparing. They have the side effect of mainly dizziness. That is their main common side effect. So for the black people, the first line drug of choice would be the thiazide-like diuretics. They have been shown to work very well. They lower the blood pressure very well. And then the next group that we use as first line drugs in the black people is the calcium channel blockers. The ARBs and the angiotensin converting enzymes inhibitors can also be used, but they are not the first line. Then the other thing that I would also want to mention, for patients who have kidney diseases, then angiotensin converting enzyme would be the first line drugs, and also the angiotensin receptor blockers. So of course there are other drugs, especially for various comorbidities. We have the beta blockers, we have the centrally acting drugs, but those are not the first line drugs. They work from the fourth level. why I'm saying from the 4th level is that you find that angiotensin converting enzyme inhibitors and the angiotensin receptor blockers are not usually, it's not usually advisable to use them together. Initially, it was thought that they can be used together in patients with kidney diseases, but now the guidelines indicate that it's not usually wise to use them together. So those are the basic information I would want to pass today about the pharmacological management of hypertension. Not to forget to mention that combination of exercises and the other lifestyle modification strategies help either use less dosages of the drugs or fewer number of drugs so that you can achieve your target blood pressure. Remember always when you're starting your blood pressure treatment, there is a target number that you should agree on with your health provider so that you work toward that goal using the 3 modalities: lifestyle change, the diet, and the drugs. So thank you very much for listening to me.